Namaskar, dosto. Good evening and welcome to another interesting session with Fertility Dose. I'm Purnima from Fertility Dose and I welcome you all on this informative session from Fertility Dose. And for arranging this session, I would like to thank UNS. So today we'll discuss about something different, something different. So because at times we do talk about low ovarian reserves, how is the quality of egg? If we have poor quality egg, then what to do? How to move ahead? Low AMH and self cycle, is it possible or not? So today we'll discuss what exactly you do when you want to freeze your eggs, or what could be the plan if you really want to move ahead with this procedure. Egg freezing nowadays is a matter of concern. Ladies all over the world, I would say, that they are considering this possibility. But is it really viable? Is it really a successful process? And is it really you, the one who really needs this? So, the process and what are the indications when you should decide that yes, I should go ahead with egg freezing, and many more things. And along with this egg freezing process, we are going to discuss about the implantation process also. When we are into this process of IVF, we usually feel that implantation क्यों नहीं हुआ, एम्ब्रियोज बहुत अच्छे थे, सब कुछ अच्छा था, लाइनिंग भी अच्छी थी, डॉक्टर सेड दैट यस एवरीथिंग इज परफेक्ट, देन what went wrong? So we really need to know about this. Okay, do we need to follow some different protocols? Do at times we feel कि नहीं कुछ तो गलत हुआ है, but again, what we can do to improve the implantation chances? So these two are different topics but interrelated to each other. So today we'll discuss about this thing, egg freezing and implantation process. So for this, we to discuss this, we have very senior doctor with us from Mumbai. So let me call her on the main screen and let's start with our discussion. And viewers, please stay tuned and do start pouring your queries related to these two topics. Namaskar, Dr. Lakshmi. Welcome to Fertility Dose.
Thank you, Purnima, for this wonderful opportunity to address queries from patients regarding to currently relevant topics. Actually, egg freezing is quite becoming popular nowadays, and it is one thing that which is needed for the current society also. Okay, and the other one is very favorite topic among all patients who are undergoing IVF implantation and implantation failure. Okay, thank you very
Right.
much for this opportunity.
So, viewers, today we have very senior doctor with us, Dr. Lakshmy Rana. She's from Bavishi Fertility Institute, and she's a fertility consultant in Mumbai branch. So, Mumbai people, and we can say that in and around the Mumbai people, if you have any issues, any concerns regarding your fertility, or you really want to start a new cycle, just don't hesitate to visit Dr. Lakshmi. Dr. Lakshmi has contributed to many books. I think the book name is Your Miracle in the Making. So it's like name itself is really very fascinating, Dr. Lakshmi. And she has presented various papers in conferences. So, viewers, please don't hesitate to talk about the main topic. And if you think there are few things that you really need to talk, then please post your queries. Stay in the session, just listen what Dr. Lakshmi is saying and what she is like, the whole new protocol process, the new things, the new techniques. We'll discuss each and everything in detail. So, Dr. Lakshmi, to start with the main topic, egg freezing and embryo implantation process. So, first of all, let's discuss about egg freezing. We know it's a fad thing now because many celebrities, many Bollywood celebrities, Hollywood celebrities, all are doing this. But do we really need this process? And uh, age is the reason that we obviously going to select this, or there are many other medical issues also? If we are having these medical issues, then egg freezing is for us, is it so?
Yeah, so egg freezing basically can be divided into two main categories. That is, why do women have to freeze their eggs? One is social egg freezing. That is what majority of the people are doing. Like, it can be divided into freezing for medical reason and also for social reason. Social reason means we know that now because of the late marriage, and they cannot find the right partner at the correct age, and also maybe they want to improve their career and their education. So all this, nowadays women are more into education and career, so maybe they get delayed in their marriage and childbearing process. So as we know, the fertility is very closely related to age. Like as age advances, especially in females, the ovarian reserve comes down, and this change happens especially after the age of 35. It starts declining rapidly after 35, and after 40 the decline is very very fast. So we all know, many times we see patients coming at 40, married after 1 year or married for 6 months, and they want to try with their own eggs. So because at that time their AMH is less, their ovarian reserve is less, the chance to conceive with the self X will be very, very limited. Of course, the chance is there, but we know that as age advances, the fertility potential also decreases. So the women need to be aware of this fact first, because they have this facility now to freeze their eggs at an younger age. Because if they cannot plan the family, or due to any reason, any social reason, whether it is financial security or job improvement or career or other reasons, they can freeze the eggs at a younger age. This can benefit them in many ways, because the egg quality as well as the quantity both goes down with age. So if you're freezing at the age of 35, then your these eggs are very very fertile, and the potential for implantation is also very good with this younger eggs. So as age advances, the DNA damage comes to the eggs, and which we cannot control now because it happens naturally. So there are various methods to increase fertility, but the natural process is there always. So we cannot, man cannot conquer this. Like we cannot get over this natural process. So one is social egg freezing. Another important arena now is fertility preservation in cancer patients, because we now know that cancer treatment and survival is very good nowadays. Many young patients get cancer, and they get treated, and they can survive, and they can later plan their family. So many of the drugs or the surgeries and during the cancer can damage the ovary and reduce their capacity to produce eggs. Many of the chemotherapeutic drugs can damage the ovary. So before that, like, they can freeze the eggs. This is a very good thing, and every oncology specialist should counsel younger women about, or even younger or even teenage girls also. This is not egg freezing for the younger girls, because but they can do ovarian tissue cryopreservation also. So that is another new thing which is coming because of the improving survival and other treatment facilities for cancer patients. So that is another issue, another one for fertility preservation in oncology, or breast cancer, any cancer, ovarian cancer at younger ages. Before the treatment, they can preserve their eggs, and it is like within a few days we can. There are certain protocols which we can start as random. Anytime we can start their stimulation and freeze the eggs as fast as possible, and then they can do the cancer treatment. Another thing is like where in medical reason for egg freezing is endometriosis. Like you might have heard of endometriosis. It is quite common among Indian population. So these are the cysts in the ovaries. So before surgery they can freeze the eggs, and then they can undergo the endometriotic surgery or the cyst surgery. We call it as chocolate cyst normally. So many times we see patients come after the surgery, after the chocolates is removal, and we see the ovarian reserve has come down drastically. So they are not aware actually. So they can freeze the eggs before, and then they can undergo the surgery. So after the surgery, maybe they may produce one, two, hardly any eggs. So that is another condition where they can preserve the eggs before undergoing any surgery in the ovary. And another one is some chromosomal abnormalities like Turner mosaic. They are prone for premature ovarian failure, so they can also preserve their eggs before, because they can go into ovarian failure at a younger age. So there is basically medical and social reasons. The celebrities, maybe they are doing for social reasons. Of course, the new age women also can do egg freezing for social reasons, because they may get married maybe at 35, 40. So at 30s they can do the egg freezing. It's relatively simple procedure, and the survival of the eggs, the vitrified eggs, is very very good. And with that, the pregnancy rate is also now very good, because of the technology called vitrification. That is a fast freezing. Previously, maybe 20 years back, we used to freeze the eggs by a technique called as slow freezing, so that the survival rate of the eggs was very less. But because of vitrification or fast freezing, there's an improvement in technology. The survival of the frozen eggs is very good, and they can their implantation potential and fertilization potential, everything is very good. So this is a good option for social as well as medical reason, because of the
Right.
improvement of technology. Yeah.
Dr. Lakshmi, usually people says that uh, cost factor involved in this freezing is too high. Is it really so?
It's not really high. It is like, of course, it will cost you the cost of an IVF cycle. But if you want to extend the freezing, like we don't know when they are going to get married, or when they go,
Hmm.
when they want to plan a pregnancy. So if you have to extend for more years, of course, the cost will be like more. Otherwise, it is not, maybe for 2 3 years, it is not very high cost. So on an average, like cost will be around 10 to 15,000 for 6 months, or maybe
Hmm.
20,000 for a year. So like that, they have to pay for the freezing extensions till they plan to use up their eggs.
Hmm.
So otherwise, it is like a cost of an IVF cycle, and maybe they have to freeze more number of eggs. Like if the patients are not producing good number of eggs in one particular cycle, they may need
Hmm.
to do few cycles, like 2 to 3 cycles. If younger age, if they're going and doing freezing, maybe in 1 or 2 cycle they get
Hmm.
25 to 30 eggs. So then there is, the cost is also not very high. But if they're going at 35, 38, they want to freeze, then they may have to do more cycles, so that will increase the cost. But nowadays the clinics are giving some packages for the, egg
Freeze.
freezing, maybe concise packages, which will not be so much costly, which will be little patient friendly. But we see
Right.
that many patients are not coming forward now in India. For like, few patients are coming, but for social reasons many are not
There.
coming forward for freezing. For medical reason, of course, they are coming because of the big institutes or oncology centers sending patients to centers where they do freezing the eggs. So, but otherwise, social reasons, very rarely people come to us for egg freezing. But in foreign countries, I think it is like many people are doing. Not the
More common.
celebrities, the common people are also doing, and even their companies, maybe like big multinational companies, may be giving them some incentives for like egg freezing and all. For their workplace, also maybe giving some holidays or money package or something for egg freezing,
Hmm.
because they are working for the company and they're not getting married. So there is like that also, it is there. But in our country, it is not happening that much. So maybe the awareness is less, or maybe the stigma is there, we don't know. But now in the metros, like, women are thinking of egg freezing, because they understand it when they come to know at a later age, and they know that their AMH is very low. So that time
Hmm.
they think back, like we could have frozen the eggs at an earlier age, then they don't have to undergo this option of egg donation. Otherwise, they have to go for donor eggs.
Right.
So if they have done the freezing before, they might have used their own eggs. So that is the advantage. So they can
Right.
tell their sisters or their cousins or whatever, like, so they can communicate to them, the patients.
Right. And I think in India, it's a social stigma that unmarried girl is visiting fertility center.
Yeah,
That
maybe
all.
that. Yeah.
Right. Dr. Lakshmi, you mentioned that it's always we have a good possibility when a younger girl is coming for egg retrieval. We could retrieve a good number of eggs. So, when you are freezing or when you are retrieving the egg from a younger lady, and like she's opting for egg freezing, so exactly what numbers you are looking for, like okay, we'll freeze 10 eggs, we'll freeze 20 or 15. So is there any number that you as a doctor are looking at?
Yeah, yeah. We normally look around 15 to 20, but it may not be possible in everybody. So depends on their AMH, their reserve, and all. So because the survival is 80%. Like if we freeze 10 eggs, maybe 8 eggs will survive this process of vitrification and thawing. Like we have to vitrify it and we have to thaw it. Like when we want to use it, we have to thaw it and bring it to normal temperature. So that double
Right.
process is there. The egg has to survive the vitrification and thawing. So it is not
Hmm.
as good as like the results are not as good as embryo freezing. Embryo freezing is we are that is very very good results with embryo freezing. But nowadays egg freezing also has very good results, but not as par with embryo freezing. But if the girl is unmarried, of course, the option of embryo freezing is not there. They can
Not
because they
there.
haven't found the husband or partner also. So normally we are looking around 15 to 20 eggs, but at least 10 eggs if they can make, then we can retrieve around 8 eggs, and we can give them a good chance for pregnancy. So
Okay.
like if we are freezing around 20 to 25 eggs, 80% chance of pregnancy is there. So that is what the statistics say. So it
Right,
depends on the
right. So,
age also. Yeah, if the
hmm.
age is more, we need to freeze more eggs because the quality is less in that. But
Right,
age
right.
less, we can
And
freeze
we
at
cannot
least
check the
100%.
quality. Right, right, right. Agree.
We cannot check the
Uh,
quality. Yeah, correct.
hmm. Dr. Lakshmi, egg freezing, we know that medically, when doctors suggest, or there are some medical issues, that women are happy to come and go ahead with this freezing technique, but unmarried girls still.
Yeah,
And one important thing that you just mentioned in the beginning, that the patients or ladies suffering from endometriosis should also consider this egg freezing thing. Uh,
yeah, correct.
so, uh,
Before the
right.
endometriosis surgery, because we see that many a times after the endometriotic surgery their ovaries, like because there is a electrical cautery and all, we when we do the surgery we are just applying electrical cautery that can damage the surrounding ovarian tissues also when we are removing that cyst. So that we have seen many patients with endometriosis after surgery their ovarian reserve is like almost very very low. So in such cases, if the gynecologist who's operating on the patient or the patient herself, they can very well freeze the eggs and do the surgery and later do the frozen embryo transfer.
Right.
Or
Uh,
whatever, whenever they are getting, if they're younger age before marriage, they are undergoing a surgery, they can do the egg freezing. Because of the pain and all, they may have to undergo the surgery. But what happens is that they are not aware. Their ovaries, like if they have bilateral, both sides they have chocolates, then after the surgery, their reserve comes down like anything. And when they come after marriage and all, we see quite often we see patients like that. But now even the gynecs or the surgeons who are operating on them can also give a advice on that. They can freeze the eggs and then do the surgery.
right. And any kind of health issues if we are going ahead with freezing of eggs?
Freezing eggs, of course, involves the injection stimulation with gonadotrophins and also the egg retrieval process, which is under anesthesia. But by and large, there are not much complications. But of course, any procedure has some complication. Like there's the anesthesia involved, there's a surgery involved. There can be very rarely bleeding, very rarely complications of anesthesia, very rarely hyperstimulation. Like when more number of eggs are produced, they can
Hmm.
go for abdominal blotting, pain, and all. So these are the few complications, but they are very, very rare because this is an elective procedure and we are like completely monitoring the patient. So the chance of complication is very less, but to mention, of course, there are complications, but they are maybe less than 1%, less than 2%.
Right. And we can say that if you are going ahead, or you really want to go ahead with this egg freezing procedure, please connect with the right doctor, and please take a note that your lab, the center or hospital which you are visiting, the lab should be in really very good condition. That is important pointers. Like few, just connect with the right doctor, and lab is really important things.
That's a good point, yeah, because the lab and the embryologist who's doing the freezing, the lab conditions, everything should be good. Then only their survival and everything is there, and there should be accountability also because you're going to,
Right.
ask for the eggs maybe 5 years later or so. There should be a proper main accountability to that also. So you should go to a proper recognized center, not like anywhere you go and freeze the eggs and later like they end up with answer of no, and also that is like you have to be careful with that. Yeah.
Right.
Yeah.
So egg freezing is really important. It doesn't matter that you are married or unmarried. If you have medical concerns, that obviously you really need to rush the things. And if, as Dr. Lakshmi just mentioned about endometriosis, it is, I think, the right decision before opting for surgery. Just check with your doctor and please freeze your eggs before surgery. Dr. Lakshmi, next we'll take about embryo implantation process. We
Yes.
all know that nowadays FETs are more common than fresh transfers. But in some cases, doctors are still advising patients for fresh transfer. So, what are such conditions where doctor advise that please go ahead with fresh transfer, and what are the conditions when doctor opt for frozen embryo transfer?
Yeah, yes, there are certain conditions where you can go only for frozen transfer. Like uh, this is like a fad thing, freeze all. The most of the clinics are now telling we are doing freeze all for everyone, but it
Hmm.
is not freeze all for everyone. It is freezing for patients who are indicated. Otherwise, you don't have to freeze all the embryos and do a frozen transfer each and everyone. Like especially the most common indication where you have to do freeze all is in polycystic ovary when they develop hyperstimulation, like in PCOD, because we know a lot of patients have polycystic ovary. Maybe 50 to 60% of our IVF cycle patients are PCOD, so they have this
Hmm.
tendency to go in for hyperstimulation. If we give a very less dose also, they produce more number of eggs. In such case, hyperstimulation is very very risky to the patient, so we cannot do a transfer in such case. So in such patients, obviously it is a freeze all, and that will improve their implantation also, and it is a safety concern also, because if you go and do the transfer, they may develop hyperstimulation, clotting disorder, all those things. So we don't want to enter into complications, because it is a elective procedure, and we want the patient safety is the foremost thing in this. Whatever treatment we do, safety is the foremost thing. So for safety, OHSs you do freeze all. And in sometimes when the hormones are very high, like the estrogen, the progesterone, sometimes early rise of progesterone is there in for some patients. So the endometrium may not be ideal at that time. There will be an advancement of the endometrium. So, and there is a particular, the window of implantation is very very small, like maybe 3 to 4 days is the exact window of implantation where if you put the embryo it will implant. So if it is an out of phase endometrium or a early rise of progesterone, then also we go in for freeze off. And another one is if the endometrial lining is not good, like if we are
Hmm.
doing a fresh cycle and the lining is not up to the mark, in such cases also we can freeze the embryos, and we can do a later frozen cycle. We can improve the endometrium. So there are few indications where you do freeze all, or in failure patients, like they have done several fresh transfers which has failed. So in such patients we can give a chance of a frozen transfer. So otherwise, for a normal patient, if the hormones are normal, if there is no hyperstimulation, the endometrium is good, you can go and do a fresh transfer. It will save the cost, it will save the time to pregnancy also, because in frozen anyway they have to wait for 1 or 2 months. So there are
Hmm.
certain many advantages of fresh transfers. Of course, the cost of freezing thawing is not there, and also the time to pregnancy, that is also very very important. So that is also saved if you do a fresh transfer. So only in indicated cases you do freeze all, otherwise not for all patients. Sometimes patients all say, okay, we want frozen, frozen. Another thing
Right.
is in dual stimulation. If you're doing dual stimulation in patients for a poor reserve, if patients have got less reserve, we do two stimulation in the same cycle. So in such case only, then also we can do a frozen transfer, because we can pool the embryos and do a frozen cycle. So there are certain indications for a normal responding patient, we don't have to do a frozen transfer, we can do a
True.
fresh transfer.
And Dr. Lakshmi, one thing nowadays, like patients are discussing about this successive transfer, like day three transfer, and again after a day,
Sequential,
day
yeah,
five,
sequential.
sequential.
Yeah,
Sorry. Hmm. So,
sequential.
what?
Yeah.
Why doctor suggests this, and is there any, like we can say that advantage of this type of transfer?
But I'm not so much of a promoter of a sequential transfer. We, in our career, have not done sequential transfer for patients. Like Okay, but this is for like recurrent failure patients. Maybe they are doing sequential transfer, and they may not be knowing that this patient may develop a blastocyst also. Sometimes what they do is they'll do a few, one or two embryo transfer on day three, and they'll culture the other embryos for the blastocyst. So if the blastocyst doesn't form, also they have a chance of transfer.
Right.
Or if they don't have a blastocyst, okay, day three we have already transferred. Or if we are keeping all the embryos of blastocyst, sometimes it may not form. So then the patient will lose the chance of transfer. So that is one advantage. Otherwise, also some clinics are doing sequential transfer. They say that there is an increased chance of implantation, but studies and all evidence is not showing so much high chance for sequential transfer. Matlab, more chance of implantation is not there for, that's what evidence says. But okay, people are trying it for recurrent failures, like they can try sequential transfer. Sequential transfer is you do day two or three embryos on day two, and then we do one blastocyst transfer on day five in the same cycle. So that's sequential transfer. What we believe is like we can do either a day three transfer or a day five transfer. So if you're sure that the patient is going to have blastosis, then we might as well do a day five transfer.
Right. And Dr. Lakshmi, one very important thing that, like nowadays, people are saying कि it's always better to go ahead with only one blastocyst transfer,
Yeah.
single blastocyst. So why so? Earlier we have seen that doctors or what patients are also like कि twins हो जाएंगे तो अच्छा है आप double blastocyst transfer कर दीजिए. But nowadays people are more into single. So any health issues related to this, or it's just a by choice wala thing?
It's not, because we know that multiple pregnancy has its own complications. Like even though twins is like looks good and looks like very good, एक ही shot में दो बच्चा हो जाएगा, you don't have to go ahead and do a second IVF for a second baby. So people used to want twins, like especially in India, like people are wanting like twins in the first cycle. So बोलते लॉटरी लग जाएगा, next time IVF नहीं करना. But now we know that the complications of antenatal complications are more in twins. We know that the prematurity is more, like babies have to be in NICU. Then other complications of the mother is also more, like high blood pressure, diabetes. So all those things are more in twins and other higher order multiple pregnancies. Like now we are not transferring more than two blastos, so then the chance of triplet is very less. But still,
Right.
even with twins, the chance of complications are more, and maybe they may not be wanting to bring together twins. That is again another, in the nuclear family, to bring up twins is also difficult. Like you see father mother and then twins, and then it is difficult. Previously, like they have the support of parents, the whole family to bring up twins. And also it is like a, to bring up twins is also difficult, and the financial cost is also more. Like if two babies are going into NICU, like your bill will come maybe 4-5 lakhs or like that. So all those things are there. So now the whole world is moving towards a single blastocyst transfer, so they can, we can do select the best blastocyst and do a single transfer. And also people who are doing IVF for the second baby, so they don't want twins because already they have a kid,
Right.
so they want only a single child. So for them also single blastocyst transfer is ideal, because already they have a kid, so they need only one kid. So in such patients with already one child, single blastocyst is the best option. Even other patients who doesn't want twins, like they say we don't want twins at any cost, then we can do a single blastocyst transfer. And now PGS is also there, so we can do a blastocyst biopsy, and we can transfer the genetically normal blastocyst. So that will all improve the implantation of a single blastocyst. So that is a good thing, because nobody wants complications of twins. Like it is a good thing if they go to term and you get good healthy babies, but prematurity is very very common, and you know
Right.
the all the complications of prematurity, expenses, and later on, like babies having retinal problem, other developmental delays. So all those things will be there for prematurity.
Right. So that's the reason, or we can say that yes, we as a patient are really more attentive about these simple things.
Yeah, correct.
So, doctor, usually we says that endometrium lining बहुत अच्छा था, thickness अच्छा था, embryo quality बहुत अच्छा था, but again failure.
Yeah.
What could be the reasons? I know it's really difficult to find out the reason, but What
Yeah.
could be the reasons, probable reasons we can say?
So there are a lot of reasons that we many a times we don't exactly know. See, the seed and the soil, that is the two important things. Like the seed is the embryo and the soil is the uterus. So if your uterus or lining is good and the embryo is good, we feel that the patient will feel that implantation should happen. Then why it is failing? So there are some micro, small things which we cannot find out sometimes which is happening inside our body. So especially also there is this, we can do the ERA test whether the endometrium is receptive at that time, because the receptive endometrium is there for like 2 to 3 days or something. So we can, in such patients we can do the ERA test that is costing around maybe 30-35,000. So we can do a mock cycle and see whether the endometrium is receptive. If it is not receptive, then we can do a give the report it is pre-receptive or post-receptive, and then we can do the transfer accordingly in the next cycle. And also we can do some other tests, like we can do a hysteroscopies. There may be some small things inside the uterus like polyps or small things, or which can cause implantation failure. Or endometritis is now the new concept, is there may be some inflammation or something inside the endometrium, which can be treated with vaginal, with probiotics or something. So there are endometrial microorganisms. Though all these things are recently developing things, like why the implantation failure occurs. So we can do all those testing. Then there is this immunotherapy which they are doing for multiple, even though evidence doesn't like say that it is good, but many people are doing for multiple implantation failure. Or we can do other tests like apla and all, whether there are antibodies inside the mother which can, which is preventing the implantation. So many tests we can do for finding out the implantation failure, so why the failure is occurring. And also we can improve from our side, like to improve the quality of the embryo, the improve the technique of the transfer, improving the implantation or the receptivity by adding more some medicines to improve. Like sometimes they give heparin injection to improve the blood flow, aspirin, etc. So all this we can try in patients with implantation failure. And also we can try the PGTA, that is the pre-implantation genetic testing, because the normal, morphologically normal embryos may not be genetically normal. They may be genetically abnormal, so we can find out that by the non-invasive PGT or the invasive PGT. So these are all the things we can do to improve the implantation in the successive cycles.
Right.
And also the sperm, also we have to look at the sperm factor also. Maybe there is DNA damage in sperm, so DNA fragmentation test, and we can improve the sperm quality, because the quantity may be correct, but there may be the quality of the sperm also can be a factor. So there are a lot of factors which can cause implantation failure.
Right. Dr. Lakshmi, you just mentioned about hysteroscopy. So, is it really necessary to repeat the hysteroscopy before every transfer?
No, no,
Or
it is not. It is not necessary. You can do, like, ideally, hysteroscopy is not necessary before a first cycle. It is only if you suspect something, like in the sonography or the 3D sonography, if you're seeing any polyp or any fibroid or anything, if you're suspecting anything, then you can go ahead and do a hysteroscopy and then do the cycle. But if you are seeing a completely normal endometrium in the 3D sonography without any other abnormality, we can do a transfer without a hysteroscopy. But in failures, of course, we have to do a hysteroscopy. It can give you a benefit, like we can find out some small things which we cannot see in the sonography, and also it gives the endometrial activation, like endometrial scratch effect also. Sometimes we do the endometrial scratching so that it generates some factors to improve the implantation. So hysteroscopy can do that also. So there are two advantages of hysteroscopy in failure cases. We don't have to do hysteroscopy before every cycle.
right. Dr. Lakshmi, one more thing that we have very like queries related to this. What about the prolactin levels? Do like higher prolactin levels really cause implantation failure?
not not matlab, yeah, even thyroid and prolactin, they are affecting the fertility, but it is not to a great extent. We cannot say that it is due to higher prolactin. Of course, if we see a higher prolactin level, we are going to treat that prolactin with medicine. So this is very easy to control the prolactin with tablets. So anyway, we have to control the prolactin and then do the treatment if it is very high. But in PCOD and all, we get a mild elevation of prolactin is always common in polycystic ovary. So we don't have to
Oh,
treat that. Like if it is 28, 30, we don't have to treat that. But it's going like 50, 100, then of course you have to treat the prolactin. It should not be very low also. It should be somewhat in the normal range. If the prolactin goes very low, also it is not good actually. So if a higher prolactin, of course you have to treat it, and then thyroid and prolactin, if it is high, you have to treat and then only you do the cycle. But it is very easy to treat higher prolactin with medicines. Maybe within 1 month it comes down with capgolin or other medicines.
understood. Right. So we cannot say that yes,
Yeah, it is.
prolactin reason for
It may not be the
implant.
reason for an implantation failure. Yeah.
Doctor, you mentioned something called autoimmune.
Yeah.
I think autoimmune is really a very common thing. People are talking about this more and more. And अगर सच पूछो तो शायद आज से 2-3 years पहले भी लोगों को इतना नहीं पता था. And right now, when you have 2 to 3 failures, or even on second implantation failure, you start talking about autoimmune. क्या ऐसा हो सकता है कि मेरे साथ कुछ issues हों, whether your doctors are suggesting or not, but you suggest your doctor that yes, doctors should tell you about those tests and all that. So what is your intake on whole this process of hype of autoimmune, we can say?
It is actually really a hype because where many RIF patients, like recurrent implantation failure patients, when we do the testing, we don't find any abnormality. Most of them, their antibodies are all normal. Like we do all the APLA or INA, all those tests, they come out to be normal. But especially in patients with recurrent miscarriage, maybe some patients have a like higher auto antibodies like APLA or beta 2 glycoprotein rises there. In such patients, of course, we have to treat them with heparin and all low molecular weight heparin till maybe around 30 weeks or 32 weeks of pregnancy, because they are going to have complications like IUGR, PIH, hypertension, growth restriction, and all. So, otherwise, in recurrent implantation failure, very rarely we have found a autoimmune positive patient actually. But of course, like without evidence also, India there is no restriction on giving any amount of medication. So maybe after two cycle or the first cycle also, people are giving heparin for all the
Hmm.
patients after transfer and all, which is actually not needed. But like, you know what, we all give these masala drugs without any evidence, like because there is no restriction on what to give and what not to give in our country, because it is not controlled by anybody, so we can give any medication. But there's actually really a hype to give heparin for all patients of IVF and all. But very rarely we find a positive auto antibodies in the mother. Anti-thyroid antibodies also we do. That is
Okay.
also, yeah, that's also significant. If there are anti-thyroid antibodies, we can treat them with some small dose of thyroid, because that is also one cause of recurrent miscarriage or biochemical pregnancies. And also we can do the all the tests. Like after two failure, of course, the patient will want to find out what is the reason. So we are bound to do all these tests also. Yeah.
And doctor, you mentioned about few more things like autoimmune is one. Obviously, that is like a fast moving test, we can say. And next is ERA test. Doctors are suggesting, or it's like other way around also, that after one failure only patients are like, let's do it. ERA क्यों
Yeah.
नहीं किया डॉक्टर ने, उसका तो किया था, मेरा क्यों नहीं हुआ? So few pointers on that also.
ERA is like maybe after two failures we can try an ERA test, but the problem is ERA is like we are doing on a mock cycle, so they will just give a in that particular. But every cycle it will not be exactly the same for the patient. Like we are giving estrogen and then progesterone, and then we are doing the endometrium and testing it for whether it is a receptive or like post receptive or pre receptive. So they'll just give the report like that, but the next cycle will not be exactly the same. Okay, so but we can do in failure patients. But one thing is it's quite an expensive test, like for us a failure investigation it's costing around 35-40,000, like, and we are not getting much of information on that also. If they are saying it is a receptive, then of course then we are also have done not a proper transfer. So It is not giving much of information. But now they are doing the genetic markers and the inflammatory markers on the endometrium. All those
Mhm.
things people are trying, and then because we need to find out what is exactly causing this failure in the particular patient. So of course patients will also demand ERA test, why you are not doing ERA test, and also it is like maybe after two failures it is better to do an ERA test. But of course it depends on the cost of the patients also. Like in our country, like patients, some patients like whatever you do, we want a baby, and some patients will say no, I want to go ahead with my XCA sub. So then we have to find out what is actually causing the implantation failure.
And it's really like I don't know whether it's true or not, but some people are saying that the success rate of ERA test is really less. So is it really so
So it is just a test that it is not it doesn't give you much information actually
much?
for the cost they are for the charges. Yeah, so it is not a very informative test. Like a hysteroscopy we are doing, like we are getting some benefit out of that. We are like finding out polyp, or we are removing the polyp, or we are at least doing the endometrial activation. But ERA, there is not much benefit we are going to gain with that. So that is, and the implantation window is exactly not one day, like we have 3 to 4 days, like so you can't say like we are every time we are going to so much out of phase and we are going ahead and doing the transfer. So we can find out the receptive endometrium by other techniques also, like by the hormones we can do the progesterone level, we can do the LH level, so accordingly we can time your transfer date. So ERA is not going to give much of information, that's a problem, that is it. So the
Right.
hype is there, but the
Right.
information we get from that is less. Yeah.
And obviously cost factor.
Yeah, another cost is like around 35,000 for a test. So that is like
Mm-hmm.
half the cost, or maybe one fourth the cost of another cycle they have to pay for an ERA actually.
Right. And what about the PRPs? आजकल बहुत
हाँ बहुत हो रहा है पीआरपी
right.
like we have found out many uh, success with PRP, like endometrial PRP and ovarian PRP. But endometrial PRP we have been doing since many years, like, and for just a borderline endometrium patients it works actually. If it is a poor endometrium, nothing is going to work. Like if it is a damaged endometrium, then whatever we do is not going to work. But for a like borderline endometrium, like somewhere between 7 to 8, 6.5 to 7, all those we can try PRP. It is of course less expensive thing. Maybe if you're doing in-house lab, it will not cost you more than 2,000, 3,000. So it is a
Okay.
very like cost effective technology. Like it is not costing you much. If you do 2 3 PRPs, then it will cost you maybe less than 10,000. So it in our practice we have found many patients PRP has benefited actually
Oh,
for the endometrium, for the poor endometrium or the
poor end.
borderline endometrium. Yeah. And ovarian PRP also for a poor reserve patients, we've been doing ovarian PRP that also increase the number of eggs and all in the after maybe 2 months, or do if we do the cycle, the number of eggs we get is more with the ovarian PRP. It is of course an invasive procedure, but still it is a beneficial procedure as far as I feel.
Right.
PRP, because the yeah, it is very easy to do that PRP to prepare the platelet from the patient's blood, and we don't have to do any much technology is not there actually in that. And endometrial PRP is very easy to do also. We have to just inject the endometrium PRP into the endometrium and for 1 or 2 settings, and this have given a few success to us
Good.
actually.
Understood. So we can say that yes, in a way, new technologies or new procedures do help.
Do
But
help.
again, it depends on individual to individual whether you really need it or not. It's not like that कि उसने किया था तो मुझे भी
So it's,
करवाना जरूरी है. Right.
depends on your case also, like what is your case, where do you stand, depend on that we can decide for each patient. It's always customized nowadays. It is not one for all, one size fits all is not there. It is like individualized approach.
Right, right. Dr. Lakshmi, any important takeaways for our viewers?
Takeaways is like, oh yeah, topic is egg freezing. So I would encourage like the younger women to like read about egg freezing, and they can volunteer for egg freezing, because the awareness is very very less in our country. And now people are like, it is not like every girl is getting married or planning a baby at a very young age. Previously it's like that by 30 your family is completed, but now after 35 they are starting to think about, having the family or having getting married and all that. In such scenario, social egg freezing is a good thing, but it should not be like just because I can freeze egg, I'll go get married at any age. So that also should not be there. It should not go to that extent. But of course, if they have financial concerns or stability issues or whatever it is, they can do the egg freezing. And because we don't know why they are not getting married, maybe
Right.
they have other reasons. But it is not like that. I've frozen my egg, so anytime I can get pregnant, so I don't mind. I'll go. That attitude should not be there. But egg freezing is a good thing that people should be aware of. Yeah. And more awareness among the you can give awareness to the teenage girls or whatever, like so then only it will go in their minds that they have this facility available, or they can go ahead and do the AMH and see how where they stand, because we see many young patients having low AMH, maybe the effect of environment or we don't know. So they are all asking why my AMH is so low.
Right.
So they can just test their AMH. If they found a low, they can do this egg freezing, and then they don't have to worry much. Like if they already have one AMH at a younger age, they can go and do the egg freezing because they don't know when they're going to get married. So that's also one thing that younger girls can do, because the awareness needs to improve. And also onco fertility also is improving nowadays, but yeah, in our country still it is not very
Common.
popular on fertility, because once they get a cancer, they'll think about other things, about the treatment, about arranging money for the treatment. They'll not think far about their like planning of
Freezing.
pregnancy and
Right.
all. So there should be some counseling in the hospitals only, so that they will get an idea about, say, these options are available. The final decision is the patient's, but they should know about the options. Like if they have lymphoma or any cancers, many are curable. Even breast cancers are, their survival is very good. May they live aram se happily for 10 20 years, so they can freeze. And the cancers are coming at younger age nowadays.
Right.
Like we're seeing more of cancers in younger age, like 30 32 you're getting breast cancer. So at that time there is this egg freezing or embryo freezing, whatever it is, like they can plan for their fertility also, like, so that awareness should be there.
So we can say that if you really need egg freezing, then don't hesitate. Visit a doctor. Just check with embryologist, check with the lab, and then go ahead. Because we really don't want to lose your eggs if you visit any other one or two hospitals that those centers or hospitals don't have proper freezing facilities. That is really important. And the other thing, if you have any medical conditions, then please check with your doctor. And if the doctor suggests egg freezing, then please don't delay. And related to new technologies, new things, PRP era and everything, they are good. They matters in lot many cases, but again, every individual is different.
Yes.
So thank you, Dr. Lakshmi. Thank you so much for joining today, and thank you, UNS, for arranging the session. Thank you, ma'am.
Thank you very much. I think I can leave.
Yes, ma'am.